Now for a look at the different options offered by Momentum Health. The next 3 slides show the Momentum Health options in terms of level of cover, limits and providers for the major medical, chronic and day-to-day benefits. Cover for major medical expenses ranges from 100% of the Momentum Health rate to as high as 300% on the Summit option. Only the Ingwe option will have an overall annual limit of R1,060,000 in 2015. In-hospital providers can be chosen on the Ingwe, Custom, Incentive and Extender options. This choice allows savings on monthly contributions. Please note that on the Custom option, a co-payment of R1,000 applies per authorization except in the case of emergency hospital admissions, motor vehicle accidents and maternity confinements. A co-payment may also apply to a list of specialist referral procedures on the Custom, Incentive and Extender options. The member guide has more details of this. Chronic benefits are subject to registration and approval. The 26 prescribed minimum benefit chronic conditions are covered on all options. The Incentive, Extender and Summit options offer cover for additional chronic conditions subject to annual limits. Whatever chronic provider is chosen determines monthly contribution as well as where to get chronic scripts and medicine. Day-to-day benefits on the Ingwe and Access options are provided by primary healthcare provider networks. On Custom, all day-to-day benefits need to be self-funded or come from the Health Saver, with the exception of day-to-day screening benefits covered by the Health Platform. The Incentive option provides a fixed percentage of savings benefits from which day-to-day benefits are paid. If not sufficient, the Health Saver can provide more cover. The Extender option also offers a savings account, and after the threshold is reached, further extended cover is funded by the scheme. The Summit option covers day-to-day benefits from risk, subject to an annual daily limit. Everyone has different needs when it comes to healthcare, be it doctor visits, chronic medication, or hospitalization. Some people want to be covered for the full spectrum of healthcare expenses, for example. Whatever your needs, Momentum Health can provide an option to suit your priorities and your budget. You will see in the following slides 6 options that can actually divide into 21 different option combinations. First, the Ingwe option. The Ingwe option is designed for members looking for affordable entry-level or basic cover. This option pays for a stay at a state hospital or at the Ingwe network of private hospitals, depending on your choice of hospital provider. The overall limit for hospital cover on the Ingwe option will increase to R1,060,000 per family in 2015. The Ingwe option's chronic benefit covers 26 chronic conditions. Chronic medication and basic day-to-day benefits, like doctor visits, are provided by the Ingwe Primary Care Network of healthcare providers. You can get a list of these providers by logging onto the Momentum Health website. The Health Platform benefit provides cover for a range of preventative care benefits available from your Ingwe primary care provider. And if you need more day-to-day benefits, you can opt for the Health Saver. The Access option offers private hospitalization with cover for in-hospital specialist accounts at up to 100% of the Momentum Health rate. Hospitalization is covered in the Access Network hospitals. Unlike the Ingwe option, there is no overall annual limit for hospitalization. The chronic benefit covers 26 chronic conditions with treatment and medication supplied by the Access Primary Care Network healthcare providers. Basic day-to-day benefits are available from the same primary care providers. The first 10 GP visits per beneficiary per year are covered in full, and co-payment applies from the 11th visit onwards. The Health Platform benefit provides cover for a range of preventative care benefits available from your Access primary care provider. And if you need more day-to-day benefits, you can take the Health Saver. The Custom option provides cover for hospitalization at private hospitals. There is no overall annual limit for hospitalization. You can access any hospital, or you can choose to receive a discount on your contribution by selecting from a specific list of private hospitals called associated hospitals. You can get a list of these associated hospitals from your financial advisor by logging on to the Momentum Health website or consulting your Momentum Health member brochure. In-hospital specialist accounts are covered at up to 100% of the Momentum Health rate. If you use Momentum Health's associated specialists, the specialist will charge according to your option rate, and you won't have a copayment on the specialist account. On this option, you need to pay a copayment of R1,000 for admission to hospital or to have a specialized procedure. Exceptions will be motor vehicle accidents, maternity confinements, or emergency treatment. An additional copayment may apply per authorization for certain specialist referral procedures. The chronic benefit covers 26 chronic conditions, and you can choose to get your chronic treatment from one of the 3 chronic providers, any, associated, or state. Further details for the list of conditions can be obtained from your Momentum Health member brochure. The Health Platform benefit provides cover for a range of preventative screening tests and certain checkups. For cover of day-to-day expenses like doctor's visits or prescribed medicines, make use of the Health Saver. It's a flexible savings facility giving members a choice of the level of savings they wish to contribute based on individual needs and budget. The incentive option covers hospitalization at private hospitals. No overall annual limit applies. Members can choose access to any hospital or choose to receive a discount on contributions by selecting from a specific list of private hospitals called associated hospitals. In-hospital specialist accounts are covered at up to 200% of the Momentum Health rate. By using Momentum Health's associated specialists, charges will be according to the member's option rate, and there will be no copayment on the specialist account. There are some procedures that require a GP referral, which may entail copayment depending on whether or not the procedure was done in hospital or the doctor's rooms. Please speak to your financial advisor, account executive, or consult your Momentum Health member brochure for more detail on these procedures. Cover is for 32 chronic conditions, and the choice of chronic providers is the same as the custom option. No limit applies to the 26 chronic conditions that fall under prescribed minimum benefits. An annual sublimit of R7,800 per family applies to the 6 additional chronic conditions covered in this option. The Health Platform benefit provides cover for a range of preventative screening tests as well as certain checkups. 10% of monthly contributions goes into a dedicated savings account to cover day-to-day medical expenses. If more day-to-day cover is needed, make use of the Health Saver. Members who choose the Extender option have cover for admission to any private hospital or can choose to receive a discount on contributions by selecting from a specific list of private hospitals, the associated hospitals. No overall annual limit applies. In-hospital specialist accounts are covered at up to 200% of the Momentum Health rate. Momentum Health's associated specialists will charge according to members' option rates without copayment on the specialist account. There are some procedures that require a GP referral and will require a copayment depending on whether or not the procedure was done in a hospital or doctor's rooms. Please speak to your financial advisor, account executive, or consult your Momentum Health member brochure for detail on these procedures. The chronic benefit is extensive, covering 62 chronic conditions, and the choice of chronic providers is the same as on the custom and incentive options. No limit applies to the 26 chronic conditions which fall under prescribed minimum benefits. An annual sublimit of R7,800 per family applies to the 36 additional chronic conditions covered on this option in 2015. The Health Platform benefit provides cover for a range of preventative screening tests and certain checkups. As with the incentive option, the Extender option pays for day-to-day expenses from the savings account. On the Extender option, 25% of monthly contribution goes to the savings account. The difference with the extender option, as the name suggests, is that if additional cover for day-to-day expenses is needed, the option will then provide extended cover after a threshold has been reached. How does extended cover work? The threshold is a fixed rand amount based on family size. Members on the extender option have a self-funding gap before the threshold is reached. This means a portion of day-to-day claims up to a predetermined rand level needs to be funded by the member, after which the scheme will pay for day-to-day benefits from extended cover. The Health Saver is an ideal way of filling the gap and enjoying uninterrupted cover for day-to-day expenses like visits to the dentist as well as medicine from the pharmacy. Members can choose at what rate claims are paid for day-to-day expenses. If claims are paid at the same rate, savings will not deplete faster when a provider charges above the Momentum Health rate, and the self-funding gap will not increase during the year. The disadvantage is that there may be co-payments on claims that exceed the accumulation rate. If claims are paid at the cost of the claim, limited to 200% of the Momentum Health rate, the advantage is that there won't be co-payment as long as there are funds available in the savings account. The disadvantage is that savings will deplete faster if a provider charges above the Momentum Health rate, and the self-funding gap may increase during the year. Extender option members also need to take note that if the associated chronic provider option is chosen, an associated GP must be used for day-to-day and health platform visits too. The Summit option provides comprehensive cover for total peace of mind. Members who choose the Summit option have cover for hospitalization at any private hospital. No overall annual limit applies. In-hospital specialist accounts are covered at up to 300% of the Momentum Health rate. If Momentum Health's associated specialists are used, they will charge accordingly, and there will be no co-payment on the specialist account. This provides an extensive chronic benefit option, 62 chronic conditions, and the freedom to obtain chronic scripts and medication from any provider. No annual limit applies to the 26 chronic conditions under the prescribed minimum benefits. The 36 additional chronic conditions covered on this option are subject to the overall out-of-hospital limit per beneficiary per year. Extensive day-to-day benefits are available from any provider, subject to the sublimits on certain benefits. Day-to-day claims are also subject to the overall out-of-hospital limit of 19,800 Rand per beneficiary per year. The Health Platform benefit covers a range of preventative screening tests, certain checkups, and more. Please bear in mind that if you join Momentum Health after the 1st of January, benefit limits on options will be reduced in line with the number of months remaining in the year.